This video will inform you about the cerebrospinal fluid collection procedure. Cerebrospinal fluid surrounds the brain and the spinal cord and can be safely collected by inserting a very thin needle well below the spinal cord without the risk of damaging the cord. Analyzing cerebrospinal fluid can give us valuable information about the brain and can help us to establish a diagnosis. Before collecting cerebrospinal fluid, the doctor will check if you can safely undergo the procedure. Among other things, the doctor will want to know which, if any, medications you use, so always be sure to bring an overview of your medications to the appointment. The procedure will be performed by the doctor and an assistant, usually a nurse. If it makes you feel more comfortable, you may bring along a family member or other person close to you. You will be asked to sit on the examination table. The procedure can be performed either while you are seated or, more commonly, while you are lying down. The proper position depends on the structure of your back and the preference of your doctor. It is important to curve your back outwards as far as possible by pulling your knees towards your chest and moving your chin towards your knees. By curving the back, the space between the vertebrae increases so that the cerebrospinal fluid is more easily accessible. When you have adopted the correct position, the doctor will start the procedure by cleaning the skin on your back with disinfectants. This might feel cold. Next, the doctor will put on gloves and search for the right location on your back to perform the procedure. The doctor will clean the back once again. She or he will let you know the moment you will feel the needle, unless you prefer not to know. The procedure is usually not very painful because a very thin needle is used. It might happen that the needle brushes a nerve. This is not harmful or damaging and is no cause for concern, but it may temporarily cause a tingling sensation or slight ache in the buttocks or leg. When the needle is in the proper location, the doctor can start collecting cerebrospinal fluid. The collection of cerebrospinal fluid itself is painless. The procedure takes around 15 minutes from beginning to end. Since such a thin needle is used, the collection of cerebrospinal fluid can take some time. After the procedure, you can go straight home. There is a chance that you might experience a temporary headache afterwards. This occurs in approximately 1 in 10 patients. This type of headache usually appears when you sit up and disappears when you lie down again. This headache is no cause for concern. Typically, it disappears on its own within a few days. If this is not the case, or if you have any other questions regarding the procedure, make sure you contact your doctor.